This is a presentation on cranial foramina and fossa. Obviously, there's quite a lot to cover on this topic, and the only things that I've included are things that are very high yield and have some clinical relevance to it. So let's get started. So first thing first, it's important to know that the cranial fossa is divided into three sections. There's the anterior, middle, and posterior fossa, and that helps to place where different structures and openings are. The bones that form the anterior fossa include the frontal bone, the ethmoid bone, as well as the lesser wing of the sphenoid bone, or depending on how you pronounce it. The middle fossa contains the sphenoid bones, as well as the two temporal bones. So to clarify, this is the greater wing of the sphenoid bone. At the top of the skull, the middle cranial fossa is also formed by part of the parietal bone. The posterior cranial fossa is formed by the occipital bone, the parts of the parietal bones, as well as parts of the temporal bones as well. Much easier to see it on the diagram. The anterior fossa is where the cribriform plate is. This contains the olfactory bulb as well as cranial nerve 1, which is the olfactory nerve. The optic canal is also found in the anterior fossa. This contains the cranial nerve 2, which is the optic nerve. In the anterior cranial fossa, there's also the superior orbital fissure, which technically is at the border of the anterior and middle cranial fossa, but I would say it's in both. It's somewhere in the middle. So the superior orbital fissure is very important. It's where cranial nerve 3, 4, parts of 5, and 6 exit the skull. So these are the oculomotor nerve, which is cranial nerve 3, trochlear nerve, which is cranial nerve 4, the ophthalmic branch of the trigeminal nerve, which is cranial nerve 5-1, the first branch of cranial nerve 5, and the abducens nerve, which is cranial nerve 6. They all pass through the superior orbital fissure. That's where they exit the skull. Moving on to the middle cranial fossa now. This contains foramen rotundum, which is where the second branch of cranial nerve 5 passes. So this is the maxillary nerve. It also contains the foramen ovale, which is where the mandibular nerve exits the skull. This is the third branch of the fifth cranial nerve, so essentially the third branch of the trigeminal nerve. The foramen ovale is also where the lesser petrosal nerve exits, and this nerve is a branch of the glossopharyngeal nerve, which is cranial nerve 9. Middle fossa also contains the foramen spinosum, which is where the middle meningeal artery passes through, and this is clinically significant because it's often the artery that is involved in epidural hematomas, and that's because it's at the pterion, and the pterion is essentially the weakest part of the skull, and it's where 4 bones of the skull meet. So the bones are frontal, parietal, temporal, and sphenoid bone. So they join over there, and it's a weak part of it. And often, in exam questions especially, they kind of say there's been a trauma to the side of the head. That's often an injury to the middle meningeal artery, and that often leads to epidural hematoma. The carotid canal is also in the middle cranial fossa. This is where the internal carotid artery passes inside the cranium. I'm going to move on to the posterior cranial fossa now. One of the structures this contains is the internal acoustic meatus. This is where cranial nerve 7 and 8 pass through. So for recap, cranial nerve 7 is the facial nerve, and cranial nerve 8 is the vestibulocochlear nerve. The jugular foramen is also found in the posterior cranial fossa. It's a very large opening, so it's divided into anterior, middle, and posterior compartment. The anterior compartment has the inferior petrosal sinus. The middle compartment, the cranial nerves 9, 10, and 11 pass through it. So 9, 10, and 11 are glossopharyngeal, vagus, and accessory nerves. The posterior compartment of the jugular foramen is where the sinus passes through, and the sigmoid sinus then joins the internal jugular vein. Or rather, the sigmoid sinus binds with the inferior petrosal sinus, and they form the internal jugular vein. The hypoglossal canal is also found in the posterior cranial fossa. This is where cranial nerve 12, hypoglossal nerve, passes through. And now I'm going to talk about foramen magnum, which is the largest opening of the skull. So this is also found in the posterior cranial fossa, so where the medulla oblongata passes through, the spinal arteries pass through the foramen magnum, the vertebral arteries also pass through it, and the spinal part of the accessory nerve also passes through this opening.